You work for decades, you pay your taxes, and you finally reach age 65. For most people, there is an underlying assumption that enrolling in Medicare means your days of worrying about high premiums and deductibles are completely behind you. You feel secure. But then an unexpected diagnosis hits. The medical bills begin piling up on the kitchen counter, and you quickly realize the government safety net you were counting on has some massive holes. Despite paying into the system your entire working life, a chronic illness in retirement can still drive you into severe medical debt. To protect your savings, you are forced to choose between two different insurance paths. Both have costs, but one contains a hidden trap locking you into a restricted network of doctors, even if you need specialized treatment. Navigating Medicare is one of the most critical financial transitions you will ever make. If you miscalculate the rules, aging goes from a time of security to a high-stakes gamble with your retirement accounts. The confusion starts with the baseline system, known as Original Medicare, which is divided into two distinct sections, Part A and Part B. Part A is your hospital insurance. Because you paid Medicare taxes during your career, you generally don't pay a monthly premium for this coverage. While you don't pay a premium, Part A still carries a heavy deductible of over $1,700, and that fee isn't annual, it applies per benefit period. If you were hospitalized, discharged, and admitted again a few months later, you owe that $1,700 a second time. Then there is Part B, which covers your general medical expenses and outpatient care. Unlike Part A, Part B requires a mandatory monthly premium. For most retirees, this premium sits around $175 a month, and the government ensures they get paid by pulling that money deducted directly from your Social Security check before you ever see it. As seen in this breakdown, Original Medicare has a critical flaw. Part B pays only $80. They are operated by private insurance companies that take your Part A, Part B, and prescription drug coverage and bundle them into a single convenient package. The primary financial draw is that Advantage plans place a strict legal cap on your annual out-of-pocket spending. If you hit a catastrophic medical year, you have a guaranteed ceiling on your budget. But the trade-off for that budget protection is a loss of freedom. Advantage plans generally operate as managed care organizations, like HMOs. You are restricted to specific, localized networks of doctors and hospitals. The private insurance company steps in as your medical gatekeeper. If you want to see a specialist or schedule a surgery, they often require prior authorization. Healthcare professionals routinely warn that this intense scrutiny can lead to care delays and outright denials. You get lower upfront premiums, but you hand over significant control. If you develop a complex illness and want to see a top specialist across the country, your plan may simply refuse to cover it. The second path is to keep your Original Medicare and purchase two separate add-ons, a Medigap policy to cover that uncapped 20% bill, and a standalone Part D plan for your prescription drugs. Healthcare navigators often recommend this path for its predictability. The rules are straightforward. If Original Medicare approves a medical treatment, the private company providing your Medigap policy is legally mandated to pay their share of the bill. Looking at this comparison, the operational differences are stark. With Medigap, there are no gatekeepers and no prior authorizations. You can see any doctor or visit any hospital in the United States as long as they accept Medicare. The catch is the upfront cost. Medigap is expensive. You will pay hundreds of dollars in fixed monthly premiums for both the policy and your drug plan. You pay that bill every single month, even if you never visit a doctor. Medigap guarantees your freedom of care and eliminates the threat of medical bankruptcy from covered services, but you pay a steep, non-negotiable premium to keep that shield active. When weighing the monthly cost of Medigap against the $0 premiums of Advantage, many retirees arrive at the same conclusion. I'll buy a cheap Advantage plan now while I'm healthy and switch to Medigap later if I get seriously ill. That assumption ignores the Medigap open enrollment period. As this timeline shows, the moment you turn 65 and enroll in Part B, a strict 6-month window begins. During these 6 months, you have guaranteed issue rights. Medigap companies are legally required to accept your application and sell you a policy, no matter your health history. But in most U.S. states, the moment that window closes, insurers can subject you to a process called medical underwriting. Medical underwriting allows insurers to request your complete health records. If you have developed cancer, heart disease, or even chronic joint pain in the years since you turned 65, they can legally deny your application or charge you astronomical premiums. By waiting until a serious diagnosis to seek better coverage, millions of seniors discover that no company will sell them a Medigap policy. They are locked into their Advantage plan's restricted networks precisely when they need medical freedom the most. Even if you avoid the underwriting trap, purchase a premium Medigap plan, and pay your bills on time, there is still one massive expense that the entire Medicare system ignores entirely. Neither Original Medicare, Medicare Advantage, nor Medigap will pay for custodial long-term care. If you develop dementia or suffer a stroke and need a nursing home or a daily at-home caregiver, Medicare does not cover the bill. A dedicated long-term care facility can easily cost upwards of $100,000 a year. This blind spot, not a hospital stay or a surgery, is the primary cause of true medical bankruptcy in retirement. If you don't have private long-term care insurance purchased years in advance, your only recourse is to deplete your life savings entirely. Once you are legally impoverished, the state-run Medicaid system will step in to cover your care. The Medicare system is strictly designed to fund medical interventions and treatments. It is not designed to fund the daily, ongoing support required in late-stage aging. The rules are rigid, but the system is slowly improving. Thanks to recent federal legislation, starting in 2025, out-of-pocket spending on Part D prescription drugs will finally be capped at $2,000 per year. There is also an ongoing debate in Washington regarding the Medicare Cost Cap Act, which proposes putting a hard limit on Original Medicare's limitless 20% liability. However, for now, it remains a proposal. Based on this dual-path system, your choice comes down to your financial profile. If you are on a strict, fixed budget, an Advantage plan caps catastrophic expenses. If you have savings and demand freedom to choose your doctors, Medigap is the required path. Whatever you decide, never make your choice based on a national TV commercial or what your neighbor bought. Medical networks, plan benefits, and out-of-pocket limits are highly localized, down to your specific zip code. Before you sign a single form, schedule a meeting with a SHIP counselor. The State Health Insurance Assistance Program provides federally funded, unbiased navigators who don't earn commissions to help you review your actual medical needs. Turning 65 does not mean your healthcare expenses drop to zero. By treating medical coverage as a mandatory, planned expense, rather than a free government perk, you can safely navigate these rules and protect both your health and your wealth.